Good to see you. Yeah, in this video, I'm going to be walking you through a full mock on a preoperative case of a patient having fractured neck of femur. It's going to be a full assessment, planning, implementation, and evaluation where we'll be handling over the patient. With that being said, let's dive in. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene, following the 7 steps of WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm overlap the zone, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of the thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My ends are clean and I will allow to air dry for 30 seconds as I approach my patient. Hello. Yeah, I'm Kenny, one of the nurses that will be attending to you today. How are you? Great. The reason why I'm here is to carry out a full set of observations on you following A to E approach. Ask you a few questions about your activities of daily living. Is it a convenient time, please? All right, before we proceed, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? Oh, great. I have Janet James. Janet James. Your date of birth is 01/01/1947. 01/01/1947. Your hospital number is 1234567. 1234567. Perfect. Assessor, I can confirm I am with the right patient and I'm happy to proceed. All right. How may I address you, please? Oh, good, Janet. All right, Janet. Can I confirm if you have any allergies at all? Oh, you have none. It is properly documented in my notes that you have no known allergy, and that is why you are on white wristband. Okay. All right. Thank you very much. I'll be stepping aside now to gather the equipment I'll be using for the assessment. Is it okay? Here is the call bell. Should you need me, do press on the call bell and I'll be here to attend to you. Is that okay? All right. So, leaving Janet now to gather my equipment, I'll go ahead and perform my hand hygiene following the 7 steps of WHO standards. Assessor, could you please confirm my equipment are clean, calibrated, and are ready for use? All right, thank you very much. All right, Janet, I'm back. Are you still happy for us to continue, please? Okay, good. So I'll be starting with a full set of observations now. I'll be starting by checking your blood pressure. Which of the arms would you prefer the cuff to be tied on, please? Oh, the left hand. Fantastic. Could you please confirm with me if you've had any surgery done on this arm previously? Oh, fantastic. I'm glad to hear that. And checking on the arm, there is no sign of infection, no bruises, no bleed, no skin lesion, right? And the arm is visibly clean. I'm happy to tie the cuff. So, assessor, I can confirm I have the right size of cuff. I will be tying the cuff about 2 to 3 centimeters away from cubital fossa, making sure it is not too tight and it's not too loose. All right, Janet, as soon as I inflate this apparatus, you're going to feel a little tightness around your arm. But do not worry, it's going to be momentarily. Is that okay? All right, so I won't be starting the machine immediately. Is it okay to use your right arm, please? Okay, to check for your capillary refill. Okay, right. So I can see the fingers are visibly clean, no nail varnish, no artificial nail. Yeah, I'll be depressing your fingers now for 5 seconds to check for your capillary refill. Is that okay, Janet? Right. 1, 2, 3, 4, 5. Yeah, I'm happy your capillary refilled in less than 2 seconds, meaning you're properly perfused. Okay, so I'll go ahead now and put the probe. Okay, then I start the blood pressure apparatus at the same time. Yeah. Okay, so you have the blood pressure reading of 148/82. Right. And your SpO2 is 96%. Okay, on room air. Yeah. So I'll go ahead now and unwrap the cuff from your arm and I will remove the pulse oximeter, keeping them aside. I'm going to be cleaning them when I'm done with the procedure. Okay. So, Janet, I would want us to be silent for the next 2 seconds now while I check your heart rate. This time, I will not be talking as well. Is that okay? I will go ahead now to palpate Janet's radial artery to check for our pulse. So, assessor, my time starts now. Right, Janet, I'm so sorry. I actually checked for your heart rate for 1 minute and the remaining 1 minute for your respiration. I was intentional about not informing you so that the reading does not get altered. I'm so sorry for this. Is that okay? All right, thank you very much. Here is an infrared thermometer. It's a device that is used to check temperature. It is not going to harm you, neither will it come directly in contact with your skin. All right, are you happy for me to use, please? Checking through Janet's forehead, there is no excessive sweating, and there is no skin lesion, no inflammation of any kind. I'm happy to check Janet's temperature. All right, your temperature reading is 37.2. Okay, thank you very much. That brings us to the end of the full set of observation. Now we move to A to E approach. Since the beginning of the procedure, you've been talking to me in 2 to 3 sentences. Yeah, I don't want to assume that your airway is patent. To further establish this, could you please make a cough, please? Oh, fantastic. Can you take a deep breathing breath for me? Good. Assessor, I can confirm Janet's airway is patent, so I'm happy to continue. Right. Talking about your respiration, Janet, the other time I checked for your respiration, it was 20 cycles per minute. Actually, because of your condition, a lot of factors could influence that. You're scoring 1 on that. It is not to frighten you. We are going to take care of that. Is that okay? Right. Check for the depth and the rhythm as well. It was normal. There is no problem with that. Okay. So talking about respiratory noises such as rattle, wheeze, or coughing, there was nothing that was heard during the assessment. Okay with that. Yeah. And talking about visual signs of respiratory noises such as the use of accessory muscles, seesaw breathing, or cyanosis, there was none that was identified during the assessment. That's okay with me. I'm fine with that. Right. Talking about your SpO2, you were saturating on hair and you have SpO2 reading of 96%. I'm quite satisfied with that. That is okay, right, Janet? And talking about your air entry, the bilateral rising and falling of your chest was happening at the same rate, meaning there is equal air entry. I don't have problem with that. That's fine, okay. Moving on to C, which is your circulation. Yeah, the last time I checked your capillary refill when I depressed your fingers, okay, actually it was okay. Your capillary refilled in less than 2 seconds, meaning you're properly perfused. I'm happy with that. Touching your upper and lower extremities, you are not too warm nor cold, meaning there is proper circulation. Yeah, I'm happy with that. Okay. I also checked for your blood pressure. You are having a systolic reading of 148 over 82. It's still normal, actually. It is said to be normal when it is between 111 to 219. Only be worried if it is equally checked your heart rate. Your heart rate was 98 beats per minute. It is slightly elevated, so you are having a score of 1 on that. Do not worry, like I said, everything is going to be taken care of. Is that okay? All right, Janet, moving on to D. If I may ask, do you know where you are at the moment? Oh, good. You are actually in the hospital. Very correct. Yeah. Do you know what time of the day it is? Great. It's actually a noon time. Well done. Right. Do you by chance know who I am? Fantastic. I am your nurse. Yeah, well done, Janet. Okay. So can I confirm the last time you visited the loo? Oh, great. About an hour ago. Yeah, I'm glad to hear that. All right. And do you feel any pain using the loo at all? Oh, great. I'm happy to hear that you feel no pain. Okay. So, assessor, could you please confirm Janet's blood glucose level and when it was last checked? Oh, great. Checked at early hour of today and it is normal. Good. Yeah, I'm quite happy with that report that your blood glucose level is normal. If I may ask, at the moment, are you in any form of discomfort? Are you in any pain? Oh, so sorry to hear that, Janet. On the scale of 0 to 10, 0 being no pain and 10 being the worst pain possible, how would you rate your pain, please? Oh, you would say 7. That's quite high. Assessor, Janet seems to be in a very serious pain now. If it were to be real clinical scenario, I would have loved to stop everything I'm doing now and attend to Janet. But for the purpose of OSCE, could you please allow me to continue? All right, thank you very much. So sorry, Janet. Where exactly is the pain? Oh, on your hip. Oh, I'm so sorry you're feeling this way. Okay. That is why you're scheduled for surgery, and we're going to do everything in our best to make sure you are okay again. Is that okay? Right. Can I position you a little? Can I put pillow behind you? Right. Sorry. Can you manage? Is it okay to be taking deep breathing breath for me? Good. So sorry to hear this. I will check through your match chart in a moment to see if you are due for any analgesia. And if not, I will be escalating your care. And as soon as analgesia is prescribed, I will come back to administer to you. Is that okay, Jenny? Or can you still manage, please? Are you still happy for me to continue? All right, thank you very much. I will be as quick as possible. Is that okay? Right, so moving on to E now, which is the exposure, Janet. On the part exposed on your body, apart from your hip that you say is quite painful now, I cannot see any sign of bruises. There is no bleed. Yeah, there is no other injury apart from your fractured neck or femur. Could you please confirm with me if on the part that is covered in your body, if there is any of these signs, please? Oh, not at all. Yeah, I'm happy about that. Okay. Thank you very much, Janet. That brings us to the end of the assessment. So, a quick one about your past medical history. I can read from your notes, Janet, that you've been a known hypertensive patient for the past 10 years now, though it's well controlled because you are on medications. Am I correct? You were equally diagnosed with osteoporosis about 5 years ago. Am I correct? Oh, so sorry to hear this, Janet. I could also read from your notes that you have not been complying with your medications. May I know why this is happening, Janet? Oh, you get tired of it and you feel it's not necessary anymore. I understand how you feel, Janet. However, I would still love to encourage you that you should take the medications as at when due, because the more you will take medications, the better for our health. So, all right, Janet, would you be willing to do this? Okay. I could also read from your notes, Janet, that you have cataract and this reduce your night vision. Is it correct? Oh, so sorry to hear this. Okay, we'll be seeing to all of this we have identified with you, and proper measure is going to be sought after. Is that okay? All right. So I'll be stepping aside now to quickly document what I've done, and I'll be back shortly to relay my findings with you. Is that okay, Janet? Right. So leaving Janet now to document, I'll go ahead and perform my hand hygiene according to WHO standard. Right, I'm back, Janet. Are you still comfortable? All right. So, following the findings, I come up with a total new score of 2. Yeah, it is not to frighten you. It does mean your frequency of monitoring will be between 4 to 6 hourly. Is that okay? Right. So, you are having a score of 1 under your respiration where you had 20. And for the heart rate, you had a total score of 98. That gives you a score of 1 equals to 2 that you're scoring. There is no problem, like I said, okay? Right. A quick one about your activities of daily living, Janet. If I may ask, how do you mobilize? Mm, okay. All right. Oh, so sorry to hear that. Okay. So, if I heard you correctly, Janet, you said you mobilize with the aid of a cane outside the house, right? And you also said you struggle occasionally due to lack of balance. Oh, so sorry, especially on low light. I'm so sorry to hear this, Janet. Don't worry. Like I said, everything is going to be taken care of. Is that okay? So how about your sleeping pattern? Are you sleeping all right, Janet? Oh, good to hear that you're sleeping fine. Yeah. How about your drinking and eating? Are you doing that all right too? I'm happy to know that you are eating and drinking all right. Okay. Also, regarding your psychosocial, I could read from your notes that you live alone in a ground floor flat. So your daughter does visits every weekend. Am I correct? So how is running errands with you whenever your daughter is not available? Hmm. Okay. Oh, good to know. Thank you for letting me know. All right. So you mean your daughter does everything before she comes the next time? Everything you need will be made available. Good. What a great daughter you've got. Yeah, well done, Janet. Okay. Regarding your religion, do you practice any religion at all? Oh, you don't. Okay, there is no problem. And you don't want to. There is no problem, actually, Janet. No problem about that. About your sexual life, do you want to say anything about that? Oh, I understand. There's no problem. You don't want to talk about it. That's good, Janet. No problem at all. So, can I confirm with you, Janet, if anybody has come to take you through the procedure that you're going for? Oh, fantastic. I'm glad to hear that somebody has already come to educate you on what to expect regarding anesthesia and everything. Oh, good. Very good to know. Right. So, can I confirm if you've signed the consent form? Oh, good. That's good. I will be back shortly to take your feet measurements, right, for the anti-embolic socks, okay, to prevent blood clots, okay. Is that right? So, apart from this, we have addressed, Janet, do you have any other concern, please? Oh, so sorry to hear this, Janet. Right, it's quite normal to be worried, especially if you're scheduled for a major surgery, just like in your case, that you're going to be having your broken femur repaired. Okay, so it could be quite disturbing. I understand how you feel this time. Right. Do not worry. We have competent ends and the facility is properly equipped. Okay. So we do not expect anything sinister to happen. Right. We expect the surgery goes on well. Okay. I would want to encourage you to engage in the activities that you enjoy. All right. This will take your mind away from your worries. Okay. So with your consent, I would like to escalate to the surgical team so that the surgeon can properly educate you on what to expect. This will further allay your fears if that is okay by you. All right. So, is there any other thing apart from this, Janet? Oh, thank you very much for your time. This brings us to the end of everything. Okay, like I said, I will return shortly to take your fit measurement for the anti-embolic socks, okay, to prevent blood clots. All right. Here is the call bell. Should you need anything, do press on it and we'll be here to attend to it. Is that okay? I will go ahead and clean the used equipment in preparation for the next use, and I will perform my final hand hygiene following the 7 steps of WHO standard. All right, colleagues, it could be that simple. That brings us to the end of A to E assessment for a patient that is scheduled for surgery to repair fractured neck or femur. I will see you shortly in planning station. Stay tuned. That was quite hot, honestly. Yeah. So as usual, I came up with two nursing care plan. Yeah, I'll be reading that to us very quickly. Right. The first nursing problem is Janet is experiencing pain due to fractured neck or femur with a pain score of 7 out of 10. Your aim of care should be Janet will verbalize relief of pain to a pain score of between 0 to 3 out of 10 following nursing interventions. The reevaluation date should be today, your exam date in bracket open and close, every 30 minutes or sooner if the clinical condition changes. Your nursing interventions now. Explain and discuss all aspects of care to Janet and obtain informed consent. Monitor and record Janet's vital observation every 4 to 6 hourly and escalate according to News 2 policy. Assess Janet's pain level using pain assessment tool. Teach Janet diversional therapy such as watching TV or reading novels to take his mind away from pain. Maintain affected leg in correct alignment with pillows or sandbags to prevent further displacement and reduce pain. Administer prescribed medication if not contraindicated, monitoring effectiveness and side effects after 30 minutes. Refer Janet to the pain assessment team/surgical team for proper package of care. Inform Janet on the appropriate use of call bell. Then lastly, on that note, document all care as planned. If you don't document, it will be tantamount to not done. The second nursing problem identified is Janet is experiencing anxiety due to unknown outcome of the procedure. Your aim of care is Janet will verbalize understanding of procedure and the recovery plan. Your reevaluation date is today, date of examination in bracket open and close. According to your monitoring frequency, in my case, it was 4 to 6 hourly. It could be sooner if the clinical condition changes. Your nursing interventions now. Explain and discuss all aspects of care to Janet and obtain informed consent. Monitor and record Janet observations 4 to 6 hourly and escalate as per News 2 policy. Assess Janet's level of anxiety and contributing concerns through open-ended questions to identify Janet's specific fear and tailor support. Next, educate Janet on the procedure, anesthesia and recovery using clear and simple terms to reduce fear of the unknown. Next, encourage Janet to express feelings and ask questions, as verbalizing worries can relieve emotional tension. Allow presence of a trusted family member before theatre, as family support can significantly relieve anxiety. Next, administer prescribed medications, monitoring effectiveness and side effects after 30 minutes if the medication is not contraindicated. Refer Janet to surgical team for further plan of care. Demonstrate and inform Janet on the use of call bell. Lastly, on that note, document all aspects of care as planned. Yeah, you have successfully written 2 care plan. I've got an extra as usual. Yeah, you can as well plan this patient on safe surgery preparation. Yeah, the nursing need now is Janet requires a safe surgery preparation. The aim of care is Janet will be safely prepared for theatre, preventing complications and promote a positive outcome. The reevaluation date is today, your exam date in bracket open and close, every 4 to 6 hourly or sooner if the need be. Your nursing interventions now. Explain and discuss all aspects of care to Janet and obtain informed consent. Next, monitor and record Janet's vital observations every 4 to 6 hourly and escalate according to the News 2 policy. Next, confirm signed and valid consent for the fulfillment of legal and ethical requirements before surgery. Next, complete pre-op checklists such as removal of dentures or jewelries. Next, secure and check IV access is patent for anesthesia, fluids and medications. Next, teach Janet on preoperative fasting, that is nothing per hora. Usually, it is 6 to 8 hourly for solids and 2 to 4 hours for clear fluids, or according to hospital policy. Administer prescribed medications if appropriate, especially to ease anxiety, and monitor the effectiveness and side effects after 30 minutes. Refer Janet to the surgeon for clarification on the procedure. Demonstrate and inform Janet on the use of cowbell. Then lastly, document all care as planned. You've got 3 likely care plan to write in this station. So this is just what I've come up with. Yeah, I never said it is the best. However, it could be useful. Yeah, that brings us to the end of planning station. I will see you shortly in implementation. Thank you for still watching to this time. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene, following the 7 steps of WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm over left thumb, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of the thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My hands are clean and I will allow to air dry for 30 seconds as I approach my patient. Hello, yeah, I'm Kenny, one of the nurses that will be looking after you today. How are you? Good. The reason why I'm here is to administer your due medications for 800 hours. Is it a convenient time, please? All right. Before we continue, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? All right. So I have on my paperwork Janet James. Yeah, Janet James. Your date of birth is 01/01/1947. 01/01/1947. Your hospital number is 1234567. 1234567. Fantastic. Assessor, I can confirm I am with the right patient and I'm happy to proceed. All right. Okay, Janet, could you please confirm with me if you've got any allergies? Oh, not at all. It is properly documented in my notes that you have no known allergy, and that is why you are on white wristband. Fantastic. How may I address you, please? Okay, Janet. Yeah. Is it okay to take you through your medication record chart, please? Okay. So I have the hospital mark chart for Janet James. The date of birth is 01/01/1947. The hospital number is 1234567. The height is 1.6 meter, weight 72 kilogram, body mass index not stated. The consultant is Dr. Tolu. The ward is orthopedic ward. The date of admission is today. The time of admission is 800 hour. Under the details of the prescriber, I have the name Dr. Tolu, the GMC number 1234567, the signature properly appended. The blip is 123. Under the page where the person administering the medication should sign, I will be coming to append my signature properly after I might have administered the medication. Under the alert and allergies, Janet have no known allergy. So the box no is ticked for Janet. Under medication risk factor, there is no medication risk factor ticked for Janet. I'm happy to move to the next page. I still have on this page hospital mark chart for Janet James. The date of birth is 01/01/1947. The rest of information on this page is as the same as the previous pages. I have read and understood the code and I will be using appropriately if need be. I move on to once only medicine. Date is today. The drug is co-amoxicillin. The dose is 1.2 gram. The route is IV. The time required is 1000 hour. It is a valid and legible prescription. However, it is not due at my time. So I move on to the next medication. The next medication, still under once only. The date is today. The drug is enoxaparin. The dose is 40 milligram. The route is subcutaneous. The time required is 2 hours before surgery. It is not due at my time, so I'm happy to proceed. It is a valid and legible prescription. I move on to the next page. I have hospital mark chart for Janet James. Date of birth is 01/01/1947. The rest of information on this page is as the same as the previous pages. Under prescribed oxygen, no oxygen is prescribed for Janet, and Janet is not a known CO2 retainer. I move on to the next medication, which is antimicrobial. There is no antimicrobial prescribed for Janet. I'm happy to move on to the next page. I still have hospital match chart for Janet James. The date of birth is 01/01/1947. The rest of information on this page is as the same as previous pages. Under regular medicine, the drug is amlodipine. The date is today. The dose is 5 mg. The frequency is once daily. The route is per oral. The duration is continuous. The time is 800 hour, which is my time. The start date is today. The finish date is continuous. The prescriber signature and blip number is properly appended. It is a legible and valid prescription. So I'm happy to give. All right. So Janet, amlodipine is an antihypertensive. It is used to regulate your blood pressure. All right. So it is a valid and legible prescription. So assessor, could you please confirm Janet's blood pressure? Oh, good. 125/85. Good. So it is safe, Janet, to administer amlodipine to you because your blood pressure is over 120/80 of mercury. All right. So I will not be appending my signature now. I will come to append the signature after I might have administered. So some of the side effects you may or may likely not to manifest include and not limited to peripheral edema, dizziness or lightheadedness. Are you still happy for me to administer, please? All right. So I move on to the next page. I still have the hospital match chart for Janet James. The date of birth is 01/01/1947. The rest of information on this page is as the same as the previous pages. Still under regular medicine. The next medication is bendroflumetazide. Right. The date is today. The dose is 2.5 mg. The frequency is once daily. The route is per oral. The duration is continuous. The time is 800 hour. The start date is today. The finish date is continuous. Prescriber signature and blip is properly documented. It is a valid and legible prescription. Bendroflumetazide is still an hypertensive medication, and what it does is it regulates your blood pressure. So some of the side effects you may or may likely not to manifest include and not limited to increased urination, lightheadedness, nausea or vomiting. Are you still happy for me to continue? All right. So I will not be appending my signature now until after I might have administered the medication. All right. So I move to the next page. I still have hospital match chart for Janet James. The date of birth is 01/01/1947. The rest of information on this page is as the same as previous pages. Under as required medicine, the drug is paracetamol. The date is today. The dose is 1 gram. The frequency is 4 to 6 hourly. The route is per oral. The duration is +5 days. The start date is today. Finish date is not stated. Prescriber signature and blip is properly documented. It is a valid and legible prescription. All right, Janet, could you please confirm with me if you are still in any form of discomfort? Oh, so sorry to hear that. Right, on the scale of 0 to 10, 0 being no pain and 10 being the worst pain possible, how would you rate your pain, please? Oh, you will say 7 still. All right, so sorry you are feeling this way. You are due for analgesia now, which is paracetamol. And I could see you have not been given in the last 4 to 6 hours. So it's safe to give you. For the recommended dosage for your weight is appropriate. Your weight is more than 50 kg and it is 1 gram that is prescribed. So I will safely administer this medication to you. So what paracetamol does is to relieve you of mild to moderate pain. Is that okay? So some of the side effects you are likely to manifest or you may not manifest include and not limited to nausea, vomiting or abdominal disturbances. Are you still happy for me to continue, please? All right, good. I will not be appending my signature now until when I'm done giving the medications. I'll come back to do that, okay? The next medication under as required medicine is lactulose. The date is today. The dose is 15 mils. The frequency is BD or when necessary. The route is per oral. The duration is not stated. The start date is today. The finish date is left open. Prescriber signature and blip is properly appended. It is a valid and legible prescription. All right. So, Janet, the last time you visited the loo, how is your stool consistency? Were you straining to pass stool? Oh, it was normal. Okay, good. All right. So, that means you don't need lactulose at the moment. All right. So, I will not be administering lactulose to you, and I will not be coding it because it is as required medication. Okay. So I move to the next page. I still have hospital mark chart for Janet James. The date of birth is 01/01/1947. The rest of information on this page is as the same as the previous pages. There is no infusion prescribed for Janet. And under the omitted part, if I omit any medication for any reason, I will come back to use appropriately. All right. So thank you, Janet. That brings us to the end of the medication chart review. So I'll be stepping aside now to quickly prepare your medications. Okay. Here is the call bell should you need me before my arrival. Is that okay? Right. So I will go ahead now to perform my hand hygiene, leaving Janet to prepare the medications. Right. Assessor, could you please confirm the medication cupboard is under lock and key and will only be open for the purpose of the medication administration, please? Okay, thank you very much. So I have on my hand amlodipine. The stock dose is 5 milligram. It is not expired. The expiration date is February 2026. I'll go ahead and compare that with my prescription to be sure it tallies. I have on the prescription the same amlodipine. The 5 milligram is prescribed. So in an aseptic manner, I'm going to be dispensing 1 tablet of amlodipine from the container to the lid and from lid to the pot, making sure my hand does not contact the medication. And I will secure the lid back to the bottle and keep it aside. Right. I will pick another pot. So prior to every medication administration, the 6 rights of medication administration principle need to be ensured. That is, the right patient, the right medication, the right dose, the right route, the right time and date, the validity of the prescription, and I will be documenting appropriately after the administration. I am sure I have the 6 rights of medication administration principle and I'm happy to proceed. So I have the next medication on my hand, bendroflumetazide. At 2.5 milligram is the stock dose. I will go ahead now and confirm with my prescription. The medication is not expired. The expiration date is February 2026. So I have the same medication, bendroflumetazide, on my prescription, and 2.5 milligram is the dose that is prescribed. I'm happy, it tallies. I'm happy to dispense. In an aseptic manner, I will go ahead and dispense the medication from the medicine bottle to the lid and from lid straight to the pot. I will secure the lid back to the container and I will keep that aside. I will pick another medicine pot, then I go to the next medication. I have on my hand paracetamol. 500 milligram is the stock dose. It is not expired. The expiration date is February 2026. I will go ahead and compare that with my prescription to be sure it tallies. Yeah, I have on my prescription the same paracetamol is prescribed. The dose is 1 gram. It tallies. I'm happy to proceed. It does mean I will be dispensing in an aseptic manner 2 tablets of paracetamol, yeah, to the lid, yeah, and from lid straight to the pot, making sure my hand does not contact it, and I will secure the lid back to the bottle. Yeah, having prepared the medication now, so I will go back to my patient now to administer. So leaving here for my patient bedside, I will perform my hand hygiene following the 7 steps of WHO standard. All right, Janet, I'm back. Are you still happy for us to continue, please? Okay. Could you please reconfirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? All right, I still have Janet James. Janet James, your date of birth is 0101 1947. 0101 1947. Your hospital number is 1234567. 1234567. Yeah, you said the other time that you have no known allergy. Am I correct? It is properly documented in my note, and that is why you are having a white wristband on. Right. So, assessor, I can still confirm I am with the right patient and I'm happy to proceed. Right. So, Janet, could you please confirm with me if you have any difficulty swallowing? Oh, fantastic. You have none. Do you have any nausea at the moment? Oh, good. I'm happy to hear that. So, how would you prefer your medication to be taken place? Is it with water or squash? Oh, fantastic. With water. Right. You want the water first or the medication first? Water first. Okay, here you go. Yeah, and here is your medication. You want the medication together or separately? Oh, together, right. So here is the medication. Good. Could you please confirm you have taken the medications by opening your mouth, please? Fantastic. So, assessor, I can confirm Janet has safely taken the medication. So, I'm happy to step aside now to quickly document what I've given. Yeah, so leaving Janet's bedside to document, I'll go ahead and perform my hand hygiene following the WHO standard. Are you comfortable? Yeah, so here is the call bell. I will be leaving you now, though I will still be within you for the next 30 minutes. Should you feel uncomfortable, please press on the call bell and we'll be here to attend to you. Is that okay? All right. So that brings us to the end of medication administration. So I'm going to be locking this drug cupboard now to keep the key in the place of safety. I will clean the pot in preparation for the next use, and I will go ahead and perform my hand hygiene following the 7 steps of WHO standard. Yeah, it could be that simple, colleagues. Yeah, that brings us to the end of implementation station. I will see you shortly where we'll be handling over this patient together. Thank you so much for watching to this time. Hi, I'm Kenin, one of the nurses on Ward 4. Yeah, I'm handling over Janet, a 78-year-old patient who was admitted with a right fractured neck of femur following a fall at home this morning, awaiting right hemiarthroplasty today. For the background, Janet presented with complaints of sudden severe right hip pain following a fall and inability to mobilize. She is a non-hypertensive patient for which she takes amlodipine and bendroflumetazide 5 mg and 2.5 mg daily, respectively. She has no known allergies. Socially, Janet lives alone with daily support. Janet is on nil by mouth as per protocol. Consent form has been signed, surgical site marked, and pre-operative checklist completed. Upon Janet's initial assessment, she had a total NIL score of 2 in pulse and respiration, and the frequency of monitoring was 4 to 6 hourly. Moving on to the assessment now. The most recent assessment for Janet is as follows. Blood pressure 142/78, SpO2 97%, respiratory rate 18, then heart rate 92, giving a total NIL score of 0. Compare with the initial vital observation where she was having NILS total of 2. She is currently stable and ready for theatre with a total NIL score of 0. 2 nursing needs were identified for Janet. First, she was experiencing pain on her right hip due to fractured neck of femur with a pain score of 7 out of 10. Her pain level was assessed using pain assessment tool. She was taught diversional therapy such as engaging in hobbies she loves, as well as deep breathing exercise to further relieve her of pain. She was referred to the surgical team for further plan of care. The second nursing need identified is Janet was experiencing anxiety due to unknown outcome of the procedure. Janet's level of anxiety was assessed by asking questions through open-ended approach. She was educated on the procedure, anesthesia, as well as recent plan to reduce the fear of the unknown. Access to Janet by family members was granted prior surgery, as family support can significantly reduce anxiety, and was subsequently referred to the surgical team for proper plan of care. My recommendation: I would recommend you proceed with planned right hemiarthroplasty this afternoon. Also continue to monitor Janet's pain level as well as her vital signs. It's worth mentioning that NPO status, that is nothing per hora, should still be maintained. Ensure to provide answer to any question asked to allay fear. That will be all from my end. Do you have any question for me? Oh, great. Do not hesitate to contact us should you require any further information. Thank you. That brings us to the end of a full mock for a patient that is scheduled for surgery to correct fractured neck of femur. Yeah, it could be that easy. I will see you in my subsequent videos. Do not forget to give this video a thumbs up, share with friends that are preparing for exam. Also, subscribe for more OSCE tips like this. And until then, keep practicing OSCE. Bye!